welcome again to our information session on the Master of Science in Global Health program at the University of California, San Francisco. So as I mentioned a moment ago, my name is Ingrid Chen. I'm Associate Director of the program and alum from class of 2013. And on our call today, we have our director, Chris Carpenter. We have our Director of Education and Strategic Initiatives, Ines Bailey, and then we have Tammy Spath, our Outreach and External Relations Officer. So we'll get into the information session, followed by questions, Q&A after that, and we can get to know you a little bit at that stage. So we are the first Global Health Sciences Master's program in the country. And our institute was established because leaders at the time in the late 1990s recognized that the way that health sciences was dealt with was siloed. So the different people involved, the academics, the policymakers, the implementers, and the funders were not talking to each other. And the consequence of all this was a lost opportunity for impact, where things were not working as well as they could. So our leaders created the Institute for Global Health Sciences so that people from different disciplines could come together, they could talk to each other, and they could solve problems with the purpose of achieving impact. And mimicking this process, we created the Master of Science program, where every year we have a group of students come together from different disciplines and learn how to talk to each other to solve problems. Because when we work together in this way, we're stronger. So a little bit about the program itself. There are 2 tracks right now. There's a full-time in-person 11-month program, and I'm mostly going to be focused on the pace of that one too, but there's a pretty new track available now that's 2-year where you can customize your learning. So yeah, we'll get into that a little bit, but yeah, the both of the tracks entail 10 weeks of global health fieldwork, and the curriculum is interdisciplinary so that we can learn about these different fields that talk about each other. Our faculty is world-renowned. There's a lot of cutting-edge research in global health happening right in our building, and we think that a low faculty-to-student ratio is a key element of success in our program. So we want to get to know you and to propel you on your journey during this short and intense program, striving to train you for global health service and leadership positions, preparing you for careers in research and policy, organizational leadership, program management, and more. So if you want to do the 2-year track, this is one way you can customize your learning. And this is flexible, so there's a balance of part-time work and other time commitments, such that you could get the space to absorb the material and dive deeper into assignments. With capstones, there's some benefits to connect with your mentor and learn from your classmates' experience. For student life and UCSF resources, you could join more clubs, attend seminars, and take advantage of UCSF resources that could be missed on a more condensed schedule. And then for community and connection, there are 2 cohorts then that you could connect with, build friendships with, and learn from, forming closer relationships with peers and faculty. And the program will give you all the tools and support you need, so you can decide how much you want to take advantage of these. But the 2-year track offers the opportunity to create your own learning journey, if that fits you better, to support both active and more structured learners. And the staff discount, staff members from UCSF get 20% off. So that's a nice little plus there. So yeah, I'll jump into the curriculum and tracks offered by both options now. And I'm showing you here Mission Hall. So when I did the program, we were in a much smaller building, and our executive director at the time arranged for Mission Hall to be built for us. And it's really awesome. The classes take place on the first floor in large classrooms. There's research happening throughout the building, such that you would have access to those researchers as a student here. And Mission Bay campus is also in a very sunny part of the city. Those of us calling in from San Francisco may most appreciate this, that there are many microclimates in the city. So this is one of the most dynamic and bright ones. It's a lot of fun. It's booming rapidly. It did not look like this 10 years ago. There's a lot of innovation and biotech, new buildings all the time, people moving into the area. There's a hospital across the street. I used to say it was new, but I think it's been there since maybe 2018 or 2017. So yeah, there's a lot happening there. Helicopter landing pad, lots of health science going on in there and healthcare. So it's bustling. There are a lot of restaurants. It's across from the Chase Center, so new restaurants there every few months. There's a gym, and it's a great place to be. So you would spend the bulk of your time here. And in terms of our curriculum, we split this into 4 thematic blocks. So you can learn about these in your coursework. And you start out by learning about the foundations of global health. So how did global health as a field come into being? Where were we and where are we today? And this is a constantly evolving conversation, bringing in a lot on ethics and philanthropy and socioeconomic growth. We also have a big focus on scientific methodologies for your groundwork. So this includes quantitative methods, qualitative methods, epidemiology, biostatistics, global health economics. And then we go into diseases and determinants. So giving an overview of infectious diseases as well as non-communicable chronic diseases. We explore these socio-cultural determinants of disease. And we also talk about health systems. So what are different types of health systems across the world? How do they function? What are their pros and cons? How did they come into being? When we talk about policy, how are policies in global health influenced, changed, implemented? How well do they actually work when something is instilled as a policy? And alongside all of this coursework, you'll be doing a capstone research project that starts the moment you come to orientation. So this starts with an early survey on your interests to start the process of thinking about what you're interested in. And I'm going to talk to you about this in more detail shortly. But it's essentially a curated research project that we work with you very closely on throughout the year, where you learn to develop research questions, defend a proposal. In the spring, you have a qualifying exam. Then you go off and do your research, which is what our students from this year's class are doing right now. They will come back in July, write everything up, package it, and then that's the close of the year. In addition to the coursework and capstone project, we create an immersive environment for you as a global health scientist. So there are many enrichment opportunities, and I give a few examples here. On the left, you see grand rounds, and this is where the experts throughout our building reach out to their networks of incredible leaders and researchers in health, and they come in and they talk to you, giving lectures on cutting edge topics. So the man in the picture here is Professor Madhu Pai. This was one of my favorite grand round speakers. He talked about decolonizing global health, and he talked about this in February of 2020 before the topic became really big and shook up how we think about partnerships and yeah, how we move forward. And there are numerous other opportunities in our classroom as well for professional development. So this includes networking, moving screenings, career development sessions, and you can see our classroom environment in the photo with some of these events happening. And I guess this photo is getting a little bit dated because you can probably guess what time period it was from based on all the masks. It's not like that anymore. One main draw to our program is the capstone research project. And it certainly was for me and why I picked this program. In this project, you apply rigorous scholarship to active global health projects in the US and around the world. If you haven't seen this on our website yet, this map, I encourage you to check it out. It's interactive. So All the countries in green are where at least one student did a project. And you can hover over any country and see the titles of the capstone projects. So this can give you an idea of all the topics and places where students have done work over the years. And I'm very proud to say that the country of Myanmar is green because of me, because there was just a very short window in which it was safe to go there. And that's when I did my capstone project. So I'll mention it in brief later as well, and you can learn a little bit about that. But throughout the years, we've had hundreds of opportunities. And today I give a quick snapshot. Here on the top left, you see one of our students working on HIV/AIDS prevention in Uganda. We have health promotion in Honduras, system strengthening in Uganda, and then snakebite prevention in Nepal. And so you might be wondering, how does the process of curating the project work? And this is really iterative. And it's one of the first things we ask you. Our big focus is on the skills you hope to gain. So you might be interested in quantitative methods where you could do a deep dive on a research question, conducting a survey and analyzing that. Or you might be interested in qualitative methods. So you might go to the Caribbean and conduct in-depth interviews to learn about people with diabetes. Or you might do statistical analysis, where I had a student a few years ago work on a genomics database looking for patterns and determinants of disease and transmission. You might be interested in program implementation, where you go work on the ground, see how things are done. You could look into monitoring and evaluation, learning about the cycle of funding and indicator assessment. A lot of our students work on policy analysis on a specific topic. So how is this playing out? What are barriers and facilitators to implementation? Our students often also do cost effectiveness analysis, and that's what I did for my capstone project. So at the very end of it, my results were used to inform the Ministry of Health in Myanmar on how to roll out rapid diagnostic tests for malaria among informal private providers in the country. Our students often also do systematic reviews, where you do a deep dive on a specific topic and become the leading expert in that one area. After the skills, we also ask you where you're interested to work. So these are general regions or countries or population you're generally interested to work with, and we do our best to match you. The priorities are the skills, and of course, we also ask you about topic areas. So here is a quick sample from hundreds of topic areas studied throughout the years. And you'll see, mental health, health literacy, promotion, HIV/AIDS prevention, reproductive health, infectious and chronic diseases, water sanitation, hygiene, immigrant refugee health, women, children's health, malaria, zoonotic diseases of increasing interest since the pandemic, healthcare systems, and capacity building. So this is just a smattering of examples, but we are all over the map on anything global health related. So you can bring your interest to us and we can figure it out from there. So I mentioned earlier, an important part of our program is working closely with you and providing mentorships. So we try to provide an extensive support team where you see you would be in the center of this, and our low student to faculty ratio is so important to us. So our faculty are really dedicated. They want to get to know you. They welcome feedback and interaction. We just went through a diversity, equity, inclusion, anti-racism curriculum revamp, looking at classroom environment as well as syllabus. And we have regular faculty meetings too, where we talk about the cohorts and how we can better support each student. We have capstone mentors and co-mentors. And for these, I had 3 of them. One was a world leader on cost effectiveness analysis. He has since retired, Professor Jim Kahn, but his protege is leading that class now, and is Dr. Tracy Lin. And then I had another mentor who was an expert in private sector delivery. So these are informal shops, if you've ever gone to parts of Asia and Africa, and I'm sure elsewhere. where you can buy antibiotics and even get blood tests from these little shops. So we have an expert here on how to assure and improve on the quality of that. And I also worked with an assistant professor very closely. She was an epidemiologist, and we worked on the project itself on a weekly basis. So those were my three mentors. In addition to your mentors, you would also have a capstone course team. Right now, we have three faculty members. They've really curated this process. So it's finessed compared to when I did the program 12 years ago. We work closely with you throughout the year to develop your project. And we have course assistants here too, which is unique to the program. So this might be similar to the teaching assistants you had in undergrad. But the main difference is that these are alumni from the previous year or two, and they're familiar with the program. So they have both a student and teaching perspective. They help you with multiple courses throughout the year. The culture in our program is very important to us, that the atmosphere is very supportive and personal, and the course assistants are a key part of that, where they get to know you and support you throughout your journey. We also have an education team meeting regularly with you to make sure everything's done as well as possible, ensuring we have regular open communication with you. And usually with us, but she wasn't able to join today, is Darlene Margolano Nguyen, and she is trained as a student counselor. She looks at student affairs, and she gets to know everybody so well. So she provides a very safe one-on-one environment with you. Just to mention that she's here alongside a larger team that we have that we work very closely with. So where do our graduates go? Besides me, I'm in academia. We have many of us stay in academia as research coordinators, analysts. We now have faculty members at Yale, at Hopkins here, UCSF, internationally as well. Some of our alum go into leadership as directors and executives at centers of cancer research, hepatitis research, refugee support programs and labs. And a number of our alum also work in the private sector. So this includes entrepreneurs. I think that's pretty unique to the Bay Area here. It's a bubbling area full of new thinking. As you know, Apple and Facebook are here, and the founder of a lot of new ideas and kind of pushing the limits through blue sky dreaming. So we do have entrepreneurs, including executive directors for health-based technologies and startups. We have managers for technical business and product teams. We have scientific researchers and analysts in companies around the Bay Area. We have consultants for public health and education programs. And our alum also often join government programs as well as non-governmental organizations. So this includes global health funders or leaders for
global health,
vaccines.
It's
sorry about that. Delivery of vaccines and healthcare. For example, some of our alum have been in Doctors Without Borders, Partners in Health, UNICEF, and WHO. Some of our alumni work for the government at the international, state, city, and county levels. And some are executives and program managers in various nonprofit organizations to improve health as well as education providers for wellness centers. So we also have a lot of our graduates seek advanced education and training. We'll get into this shortly. Some people come in with these degrees, others pursue them after or may take a gap year. But many of them go to medical school to later become practicing physicians. A number of people from my class are now done with their residency and med school after doing the program. Some people also do a PhD, and we see that a lot where people we're not planning to pursue a PhD, but get really into research within weeks of joining our program, and will apply for PhD programs for the next cycle. It's increasingly common. And then, yeah, there's people who come in with doctoral degrees and do postdoc after. That's how I transitioned into working at the Malaria Elimination Initiative here after working for our program, and then just grew in my career since then. And we also have people become research fellows after doing our program. So hopefully that gives you an idea. We have a alumni database now for the first time, which is really, really exciting and inspiring. And I think people are really dynamic and creative and have gone all over the world to do different impact-based jobs on global health. So if you're wondering at this stage if your background is suitable to apply, then I would say it probably is, because we rely on diversity to bring the conversation alive. And this is to mimic the way that decisions are made in global health settings. So our students come from all sorts of backgrounds. For example, many students come in with a bachelor's degree. People often ask if that's okay. And yes, it's more than okay. I would say around half of our students come in with that degree. Others come in with a master's degree, a business degree. This year we have a very experienced businessman come in after, doing years of work and, just wanting to expand horizons. And we've had lawyers come in, we've had people with PhDs, which is where I was when I came in and did the program. And many of our students also have advanced clinical degrees. So this is anything from experienced nurse practitioners, doctors, dentists, pharmacists as well. Our students also come from a variety of professions. So this includes, clinical care providers, such as EMTs, physicians, nurses. We've had engineers, researchers, biochemists. I was a chemist when I came in, teachers, people just from all over the map. So in terms of areas of study as well, this is just a smattering of examples. And you'll see a lot of science here, but we also have English and philosophy majors come in, and people who worked in health education, industrial engineering, and nursing, psychology, public health, religion, health, and medicine. So the diversity of our students makes our program unique and makes every cohort strong and different. So you don't know what the mix is until you come in here, which I think is really, really exciting. So the last thing I'm going to go over, and you might have seen this on our website already, is the nuts and bolts of the admissions process. So the components are here on the website, but we rely on a personal statement, resume, transcripts, letters of recommendation. If English is your second language, sometimes we ask for TOEFL scores. We have an application fee, but if you need a waiver, there's an option to request that in the online application. And we do not require GRE or MCAT scores. So if you have those, feel free to include them in your application. They're entirely optional. Admissions are reviewed holistically. So we look at the whole package together, and admissions are open right now. So we do ongoing review of completed applications. We try to give a quick turnaround within the next month or so that if you're admitted, that can hopefully help you with planning. But we do encourage you to apply whenever you're ready. So I think we encourage, if you're an international applicant, to apply as soon as possible, because it's a bit tight now to arrange for a visa to come to San Francisco. But we have our final deadline for all applicants, especially those in the States, by the end of June. So we encourage you all to get in touch. Tammy keeps a close eye on the mailbox, so you will hear back from her if you reach out there. And we definitely want to learn from you, learn about you, and to explore with you whether this program might be the right fit for you.